Now, other than this ascending branch, the inferior thyroid basically ends up giving like 5 to 7 glandular branches. Glandular because they're going to supply the gland, get it? Very simple. It's going to pierce basically the capsule, and it's going to sort of like pierce into the gland and therefore supply it. Alright, so a couple of things I would like to reiterate. The anastomosis between the posterior branch of the superior thyroid artery and the ascending branch of the inferior thyroid artery happens along the posterior border, and the superior parathyroid glands and the inferior parathyroid glands are also located alongside the posterior border. The inferior thyroid artery, and obviously this is very schematic, after giving this ascending branch, it basically continues as 5 to 7 glandular branches which pierce into the gland. And so we basically discussed the arterial supply along with the relations. Very convenient. Let's go over a couple of things again. This is the thyroid gland. It is located opposite the C5, the C6, the C7, and the T1 vertebrae. And this is very important as far as MCQs are concerned. And this part is the isthmus, right? And when they talk about the dimensions of the isthmus, it is said to be 1.2 centimeters long, 1.2 centimeters wide, and 1.2 centimeters thick. And this is comparatively lower yield, but it is still something that can be asked, right? Alrighty, and it is basically overlying the the second and the third tracheal rings, right? Sometimes it's at the third and the fourth, whereas the base is lying over the fourth and the fifth tracheal ring. So again, things to consider. And then this is the isthmus portion. These are the lobes, and we basically have taken a section at this point, and we've gotten this, and this is the anterolateral surface, and in Virachurasi it is written to be the lateral surface, whereas this is the medial surface, and this one over here is the posterolateral surface, right? And we have the borders over here. This is the anterior border, right? We have an anterior border, and that is what we're seeing is basically the lateral surface. There will also be a medial border. My apologies, there will also be a posterior border which will be separating the posterior surface from the medial surface. Now, some claim simply call the posterolateral surface as the posterior surface. So there's a bit of a variation over here in between the various books. Alright. Anyways, I'm hoping this makes sense. And again, the relations, the lateral or the superficial or the anterolateral surface are related to the infrahyoid muscles. And if you take a look at the root of the neck, you will easily be able to see this. Sternohyoid, and this is the superior belly of the omohyoid, and this is the sternothyroid, and this is part of the sternocleidomastoid. And the relations of the posterior surface or the posterolateral surface include the carotid sheath, and then we have the trachea and part of the larynx, and we have the esophagus and part of the pharynx, and we have the nerves, the superior, the external laryngeal and the recurrent laryngeal. And again, these are very important things. Now, the venous drainage is also of relative importance. So we consider a total of 3 veins, even though we just talked about 2 arteries, that being the superior thyroid and the inferior thyroid. And there's a superior thyroid vein, there's also a middle thyroid vein, and there is an inferior thyroid vein. And you must really try your best to remember where they drain, because this comes up in terms of the thyroid gland and also in terms of the veins themselves, right? So round about near the apex, we have the superior thyroid vein come out and drain into this disproportionately big internal jugular vein. You should probably not draw it as big. This is just supposed to be a schematic, so you find it easier to get to be able to retain the basic concept. After this video, I would suggest that you should take a look at an atlas so everything fits in place, right? So this over here is the superior thyroid vein draining into the internal jugular vein from near the apex, and near the middle of the gland we have the middle thyroid vein also draining into the internal jugular vein. At least that much is very convenient. Now there are also the inferior veins, and they sort of like, we sometimes claim that the inferior thyroid veins are actually a relation of the lower border of the isthmus, and that is a very valid claim because the right and the left, in this case, right drains into the right internal jugular vein and left into the left internal jugular vein, but the veins, the lower thyroid veins or the inferior thyroid veins, which come off the lower border of the isthmus, they drain into this vein over here known as a brachiocephalic. Both the right and the left inferior thyroid veins basically form something of a plexus which drains into the left brachiocephalic vein, right? And I'm really kind of like going to show this, right? So this is left brachiocephalic, not the right. That is important. Left brachiocephalic, right? And this is the internal jugular vein and this is the subclavian, and the two of them together basically make this up. This is very important that you kind of like grasp this drainage. It is extremely important. There's this one very MCQ-ish point which they tend to give a lot, and that is the concept of the lowest thyroid artery, right? And so we talked about superior and inferior. Now we have a lowest thyroid artery, and this is a anatomical variation. It's not present in everyone, just in 3% individuals, so it's common enough that you should know. And it is also known as this particular name, right? And this either comes off directly from the arch of the aorta or from the brachiocephalic trunk. We also have an arterial component, the brachiocephalic trunk, which is on the right side only. My apologies, the left side only. Right, so this is an MCQ-ish point that must be remembered. A couple of other things: when you're carrying out thyroidectomy, usually the posterior part of the thyroid gland is left behind, such that the person, after getting treated for hypothyroidism, does not inadvertently develop hypothyroidism. So these are the most important bits. I'm hoping you found this to be helpful. If you did, please like, subscribe, and leave a comment.